Thank you, Chris, Richard, and all my panelists. Thank you for the opportunity to present today on behalf of my co-authors the role of a community empowerment approach to the HIV response among sex workers. Today in this talk, I will present on the effectiveness, challenges, and considerations for implementation and scale-up of this critical strategy. By way of background, I just want to emphasize that sex workers' risk for HIV infection is characterized across many settings by powerful structural constraints, including criminalization and human rights violations. Additionally, sex workers are exposed to multiple forms of stigma and discrimination, including that of their socioeconomic position, gender, sexual orientation, HIV status, and occupation. Without addressing these factors, the HIV response among sex workers is likely to be limited in its effectiveness. A community empowerment-based response to HIV specifically means a process by which sex workers take collective ownership of programs to achieve the most effective HIV outcomes and to address social and structural barriers to their health and human rights. This type of strategy has actually been a UNAIDS best practice for over a decade and now currently underpins multiple key UN policy documents, including normative guidelines and program implementation tools. Individual evaluations of community empowerment efforts have shown it to be a promising approach to reduce HIV among sex workers, and recent mathematical modeling suggests that comprehensive community empowerment approaches among sex workers can significantly reduce HIV incidence both among sex workers and the general population. However, investment in this approach has been relatively limited. In turn, to further explore these issues, we conducted a comprehensive review of both the peer-reviewed and practice-based literatures on the implementation, effectiveness, measurement, and barriers and facilitators to a community empowerment response to HIV among sex workers globally. Nested within this comprehensive review, we conducted a systematic review and meta-analysis of the effectiveness of a community empowerment approach on HIV-related outcomes in lower and middle-income countries. This was over the last decade and involved specifically 22 studies and a total of over 30,000 participants within those studies. 4 case studies were also developed, highlighting structural challenges faced by sex workers across settings and their collective responses to reduce their HIV risk and promote their human rights. I want to first highlight that community empowerment is not a specific intervention activity. It is an approach. It is set within a broader health and human rights framework, and what it does is shape and create synergy across all the different types of intervention elements that Linda Gale just mentioned. And these span the biomedical, the behavioral, and the structural. In turn, community empowerment cannot be reduced to a specific activity or a drop-in center or a set of mobilization activities. It is rather the integration of all those activities within this larger framework. In terms of the implementation of community empowerment, what we note in the literature is that while this is not a linear process, we often see that the process starts with the promotion of internal social cohesion within the sex worker community. That internal cohesion, solidarity, and collective power is then leveraged to address the social and structural context of HIV risk within a given setting. And ultimately, the goal is to promote sex worker participation and to change access to material resources, including access to HIV services, but not limited to those. In terms of the effectiveness, here I'm presenting the findings from our meta-analysis. And what we found was that comprehensive community empowerment approaches to HIV among sex workers is significantly associated with improvements in all of the outcomes that we assessed. And these include HIV, gonorrhea, chlamydia, syphilis, and consistent condom use with all types of partners. Specifically, we saw a 32% reduction in HIV, or in the odds of HIV infection, and we saw an over 3-fold increase in the odds of consistent condom use among those exposed to comprehensive community empowerment interventions. On the issue of measurement, what we observed in the literature is that traditional HIV prevention indicators are still being utilized to a great extent, We're still assessing access to clinics, access to peer educators, educational materials, and condoms, while we also need to expand and include indicators of the community empowerment process itself, processes of social cohesion, mobilization, collective efficacy, and while there are a few examples of these in the literature, they are often being measured still at the individual rather than the environmental structural level, calling for innovation in this regard. Now I'd like to talk briefly about some of the barriers and facilitators to community empowerment that we documented in our comprehensive review after coding more than 100 documents from both the peer and practice-based literatures. At the global level, we really see that the discourse is hampering community empowerment in terms of a discourse that is focused on rescue and rehabilitation of sex workers and the conflation of sex work and human trafficking. We also see that donor investment priorities and funding conditions are limiting the ability of sex worker groups to access and manage funds. At the state level, we see laws criminalizing sex work and associated behaviors, as well as police harassment, hampering, again, community empowerment efforts. And at the community level, we see the significant impact of stigma, discrimination, and violence in terms of limiting the ability and motivation of sex workers to participate in community empowerment efforts. However, in response, we see sex worker collectives across settings, organizing, forming networks, and advocating for their place in policy discussions and planning processes. We see advocacy to decriminalize sex work. We see training of healthcare providers and police. And at the local level, we see the creation of safe spaces, grassroots organizing, and community mobilization. Briefly, I want to share with you an excerpt from one of the case studies that we developed for this paper. This is from the Ashadaya project in Karnataka, India. It is an example, a concrete example of what we mean when we say community empowerment-based response to HIV among sex workers. In 2004, researchers from the University of Manitoba conducted a formative assessment that highlighted the need for safe spaces, violence reduction, and basic health services. Quickly, it became clear that the project needed to work more closely with the community, involving sex workers in all aspects of the project, including decision-making. This led to a real emphasis on active community mobilization among sex workers, coming together for public events to gain visibility and assert their rights. In other words, it shifted from being an externally driven research project to the beginning of a community-led effort. Within 1 year, the organization of sex workers, Ashadaya Samiti, or Dawn of Hope, was established with a democratically elected executive board. Within 3 years, over 4,000 sex workers have become members of Ashadaya, and program monitoring showed a saturation in HIV prevention coverage, and integrated biological and behavioral assessments showed significant progress on key HIV outcomes, including increases in condom use and declines in STIs. By 2007, Ashadaya started dissemination of this model through a community-to-community learning program to help strengthen other sex worker organizations. It now offers technical assistance to sex worker organizations in India as a national learning site and has expanded through the Ashadaya Academy, offering capacity strengthening to sex worker groups in the Asia-Pacific region. In partnership with the Global Network of Sex Work Projects, Ashadaya, along with VAMP, another Indian sex worker organization, is also providing technical assistance to develop a Pan-African Sex Workers Academy. Today, the sex worker-led organization Ashadaya Samiti has over 8,000 members. The community runs all its own programs and has an annual budget of over $2 million US. And that is what we mean specifically when we talk about a community empowerment-based response to HIV among sex workers. Coming back, and in conclusion, I want to highlight that community empowerment as an approach holds significant promise as an effective approach to reduce HIV among sex workers. The evidence is consistent and compelling, and it must be integrated with combination HIV prevention efforts. Our findings highlight the important challenges associated with its expansion, including the need to change the global discourse and the full recognition of sex work as work. Greater support is needed to enable sex worker groups to more effectively and sustainably overcome the barriers we identified here, including funding for sex worker-led groups and the support of practice-based evidence. I'd like to acknowledge all the individuals listed here for their contributions to this process, in particular the sex workers who led and participated in the research and programmatic efforts which are the basis of this analysis, and I thank you for your time.